Sickle cell disease is an inherited blood disorder, so people with sickle cell disease are born with it. It mainly causes pretty significant anemia and can cause severe pain throughout a person's life. Due to the expertise that our team has here managing people with sickle cell disease, we were able to treat our first person with sickle cell disease with a new gene therapy product.
I was diagnosed when I was a kid. My family was told that I have the sickle cell anemia. My life was very restricted with my disease. It was very hard for me to be like my friends and my siblings, practice any kind of sports or to go to the gym or to do any hobbies.
Destination Medicine is our international and out-of-state patient program for the Ohio State Wexner Medical Center. So we care coordinate for patients that travel to our medical center. In the 12 years, we now count over 120 different countries that we have welcomed patients. Khaled came to us from UAE, that's his home country. Their citizens are provided the option of receiving care out of their country when it's appropriate, and they provide full support for this. That conversation led to a referral of Khaled to our center, a formal referral, and that's when services started a few months later.
So this was our first gene therapy for sickle cell. It is a fairly busy and long schedule. This particular patient, basically almost a year with us. What this does to the cells is essentially recap how we make blood before we're born. And this fetal hemoglobin, it's not necessarily, we're not correcting the actual sickle cell defect. We're making the cells produce more fetal hemoglobin, which in turn it holds more efficiently to oxygen. So this change is enough to make those cells less likely to burst as they do normally. So the expectation with that, right, is that he will not show the usual manifestations of sickle cell, the crises, the chest pains. And they are the first one to tell you when these things start calming down. You know, this doesn't come from us, right? This is the message that comes from the patient, not from the doctor or the nurses.
When we ask ourselves what it means to cure a patient with sickle cell disease, would it mean looking at labs and seeing no sickle hemoglobin? Or would it be, I was able to stay out of the hospital for years and I was able to go back to school or go back to work or start a family? And I know Khaled talked about all of those things, being excited to go back home and, you know, start a family and do some of the things that we, I think, call normal for a 20-something-year-old. Those were the signs to me that it was working and that we might, you know, be able to say, wow, I think we've cured him.